Hi, Dave with Align Therapy here. I'm here with Kelsey. Kelsey is someone who has scoliosis, and I thought it would be good to use her to demonstrate what the Schroth Method is and what we actually do in the Schroth Method. It's a question that we get a lot when I see someone for the first time, and I evaluate their back, and they ask me, well, what is the Schroth Method? What exercises do you do? And I think a lot of times they're thinking core exercises and things like that. And Kelsey's gone through this before. Maybe that's a question that you had on the first day that we saw you, but I really want to demonstrate what they're like so that you have an idea of what Schroth Method exercises do. This is specific to Kelsey's curve, so I don't want you doing this at home. I can't emphasize that enough because your curve is probably different than Kelsey's curve, and I don't want you doing an exercise that's wrong for your curve type. So I really suggest finding a Schroth therapist that knows what they're doing with your curve type and training with that. So just remember, don't do this at home. This is just for demonstration so you can see how this works. So what we're going to do first, we identify where the curve is. So on Kelsey, we have a curve that goes to the right. So it goes to the right in the thoracic, and you can tell that because this shoulder blade sits back further than this shoulder blade. Sometimes it's hard to see on a video because you're not seeing in 3 dimensions. She also has a curve that's lower in the back to the left, and if she relaxes a little bit more, yeah, there we go. She shifts to the right with her trunk and her pelvis shifts to the left. The reason for that is this is her main curve up here up top. And if gravity takes over and she's not actively correcting that, then this concavity on the left side is going to collapse a little bit more, and we're going to see this shoulder go down. We're going to see her shift to the side. So that's Kelsey's curve. So what we're going to do now is we're going to use the Schroth Method to activate different muscles and breathing patterns to reduce the imbalance that we see. So the Schroth Method is designed to treat all 3 dimensions of scoliosis. What I mean by that is one dimension of scoliosis, we have a C or an S in the spine. So that's one plane that we see. The other aspect of scoliosis, the other dimension, is the rotation. So in Kelsey's spine, you can see that she rotates back like this on the right side and forward on the left side. So we have a rotation associated with that. Then if we looked at her from the side, we don't have to change the camera view, but from the side, if we look at her back, it's fairly straight, like straight up and down. Normally we have a curve in the upper back that goes out this way and a curve in the low back that goes this way. In Kelsey's back and most of those with scoliosis, we see a straightening of the kyphosis in the upper back. So all those 3 dimensions we want to work on with the Schroth Method. So we use breathing techniques and muscle activation. So let's go through this just a little bit and see what progression we're able to see with Schroth exercises. So first thing, Kelsey, that we do is we sit tall, which you're already sitting tall. Kelsey has good posture already.
Thank you.
So that's half the battle right there. Then we are going to correct her pelvis. So naturally she wants to go this way. So we're going to correct her pelvis where her trunk is centered over her pelvis. So that looks really good. She's centered over the pelvis and she's sitting up nice and tall. So that's part of correcting the base. We want to start at the base because that's where we can build off of. Just like you're building a tower with building blocks, we want to start with the bottom block. If that bottom block is tipped, then the whole tower is going to be tipped. So we don't want that to happen. No leaning Tower of Pisa or anything like that. Not that you're a leaning Tower of Pisa.
Yeah.
But so we've corrected the pelvis, we're sitting tall. So now put your hands up on this bar, Kelsey. And she's going to take her elbows and push out. That helps to open the ribs up. And then I want her to take some deep breaths, and each breath we're trying to feel expansion through the ribs. So that expansion, we can see right now that she's expanding on the left and the right and everywhere. We're trying to elongate the spine. We're opening things up by elongating upward. But we have to keep in mind that this part of her spine is straight front to back. We don't want this to get too straight. So if she gets too tall and I pull her hair and she gets too tall up here, we start to lose that natural curve that should be there here. So I pull her back a little bit so that we keep that. So now what I want you to do is try and breathe and expand into that concave side. Give me a big breath right there. Good. Can you feel that? That was good. Try to keep that shoulder relaxed, elbows pushing out, and we're going to breathe and expand right there. Good. So we expand outward into the concavity. Some people say you can't breathe into one lung and not another. You're right. We breathe into both sides, but we're allowing expansion on the left side more than on the right side. Very nice. Head tall. So we have one other dimension that we need to work with, and that's the rotation. So we'll breathe in rotation where she breathes back on the left and forward on the right. That is fantastic, Kelsey. It's been a while since we saw Kelsey, and I think there's a little muscle memory going on here. This is good. So backward on the left and forward on the right. So we're getting a derotation in the spine. So every curve is different. Push out here a little more. There. Now breathe again in derotation. Back here a little more. Perfect. So each curve is different. Some have more rotation that we need to correct. Some have less rotation. But really what we're trying to do is the imbalances that we see and the asymmetries that we see, we want to change the breathing patterns and the muscle activation to reduce that, to just unwind the spine, elongate the spine, and bring the curve back towards midline. So hopefully that makes sense. Hopefully it clarifies a little bit what we're doing with the Schroth method. The Schroth method is done in multiple positions. So here we're doing a sitting correction. We do it in standing, we do side lying, we do a bunch of different corrections. You can go and relax, Kelsey. And each position that we do has a different benefit. And so there's a lot of things to the Schroth method. It's been the most researched out there, and that's why we choose it to do for most of our scoliosis patients. So hopefully this helps. We did a part 1 of this video, so you kind of look at that, me explaining with a spine, but now we're explaining with an actual person that has scoliosis, and it's a lot easier to see, and Kelsey does fantastic in getting that derotation and that breathing. So thanks for your help, Kelsey, and thanks for watching, and tune in next time.